What causes limited access to AFP markers for liver cancer? Imagine trying to find a specific person in a crowded room using just a vague description. That's similar to what doctors face when using alpha-fetoprotein, or AFP, as a marker for liver cancer. AFP is a protein made by the liver during fetal development, and in adults, its levels are usually very low. When liver cancer, especially hepatocellular carcinoma, develops, AFP levels can sometimes rise. For decades, AFP blood tests have helped doctors in diagnosing and monitoring liver cancer, often alongside imaging scans like ultrasounds. But despite its usefulness, there are many reasons why AFP testing isn't always the go-to tool for everyone. One big reason is that the AFP test isn't perfect at telling who has liver cancer and who doesn't. Its ability to correctly identify cancer, called sensitivity, is limited. It can miss some cases because AFP levels might not be high enough to detect. On the flip side, AFP can also be elevated in non-cancerous liver conditions like cirrhosis, hepatitis, or liver regeneration after injury. This means the test can produce false positives, suggesting cancer when there isn't any. Because of this, major health organizations don't recommend AFP as a standalone screening test for liver cancer in the general population or even in high-risk groups. Another challenge is that AFP's accuracy varies depending on individual health factors. For example, AFP tends to be more reliable in patients whose liver disease isn't caused by hepatitis C, but in those with hepatitis C or fatty liver disease, AFP levels might not reflect cancer presence as clearly. This inconsistency makes it hard to set a universal cutoff level that works for everyone. So, doctors often need to interpret AFP results carefully, considering each patient's unique medical history. Technical issues also play a role. Different laboratories may use different methods to measure AFP, which can lead to variations in results. This lack of standardization makes it tricky to compare AFP levels across different labs or over time. While combining AFP with other blood markers like AFP-L3 or des-gamma-carboxyprothrombin can improve accuracy, these tests are not yet widely available or routinely used everywhere. Furthermore, imaging techniques like ultrasound computed tomography scans and magnetic resonance imaging are often better at detecting liver tumors early and accurately. These imaging methods are usually the primary tools for surveillance in people at high risk. Because they can directly visualize tumors, they tend to be more reliable than blood tests alone. That's why guidelines often recommend imaging as the main approach, with AFP playing a secondary role. Lastly, AFP can sometimes give clues about how aggressive a tumor might be or predict patient outcomes. But it's important to remember that an elevated AFP isn't a definitive diagnosis. It can suggest the possibility of cancer but cannot replace biopsy or detailed imaging for confirmation. In summary, the limited access to AFP markers for liver cancer isn't about the physical availability of the test. Instead, it's about its clinical limitations. Its low sensitivity and specificity, variability among patients, lack of standardization, and the superior accuracy of imaging all contribute to its restricted role. For anyone concerned about liver health or at risk for liver cancer, the best approach is regular checkups with healthcare professionals. They will typically use a combination of imaging and blood tests tailored to individual risk factors. Always consult a healthcare provider for personalized advice and the most current diagnostic strategies.